Hi, my name is Dr. Martin Lerner. I'm a chiropractor here in San Diego, California, and putting together a few videos for my patients to demonstrate some spinal rehabilitative exercises. If you're not one of my patients, make sure you check with your own doctor before doing any of the exercises or anything else I'm advising on my channel here. This next spinal rehabilitative exercise is for your neck and upper back area. Just call it a cervical or a cervicothoracic stretch. And this you have to be very careful with because neck is a very sensitive area. So it's very important to do this exactly as prescribed and to be really paying attention. I suggest doing it in front of a mirror. Really be focused and not distracted by other things. So because you can really get hurt if you do this wrong. So cervical and cervicothoracic stretch. So what you do is you're standing up straight, looking straight ahead, take your arm and you place your fingers kind of above your ear on the other side like that, and just let your arm gently stretch your neck to the side, just as far as it'll comfortably go. Don't do anything that hurts or feels uncomfortable, and hold it for maybe a 5 count. And very important is to not let go at this point. What you want to do is when you're finished with your 5 count is make sure, bring your head back up to neutral before you let go. Never let go or start this exercise unless your head and neck are in this neutral position. So same thing, other side. Just bring my arm up here, hands are going right above the ear, and then we're just bringing the elbow down towards the ground on that side. Oh, feels good. And that's the thing. You're doing this right if it feels good. If it doesn't feel good, you're going too far, you're pushing it too far. Okay, so I'm going to bring myself back up to neutral again before I let go. Okay, so there's that. You can do that 2 or 3 times to each side. Now there's a variation on this. So after you've done that, we're going to do something. We're going to bring the head forward and try to stretch these muscles right here, the upper trapezial muscles that's tight and tense on most people. So for that one, we're going to, instead of grabbing here on the side, we're going to shift back and not grab all the way in the back, but halfway between the side and the back of the head, we're going to go to this halfway point between the side and the back, and now my elbow's out front, and what I'm going to do is I'm going to turn my head slightly to this arm, to my right in this case, and then I'm going to pull my elbow down towards my foot on the same side. And so you just hold that again, and then as before, don't let go until you're back in a neutral position. Same thing, other side. Let me get this halfway point between the back of my head and the side of my head, and stand up straight, feet shoulder width apart. I'm going to bring this elbow, I'm going to turn my head slightly to the left this time and bring this elbow down towards my shoe on that side. Oh, that's good. So I'm feeling a nice stretch on the right side of my spine. And then back to neutral. So that's how you target those areas. It takes a little bit of practice to get it right, but the key with these cervical stretches and all the spinal exercises really, but especially with the neck, is to stay within your comfort zone. Don't try to do it as far as I'm doing it. You may have an injury, you may not be as flexible as me, so go as far as your body will let you go comfortably, and that's it, and just hold it in that position for a 3 or 5 count, whatever you'd like, but keep it pain-free. That's the main thing.